So, Dr. Keppel, as a chiropractor, you deal with bones, obviously, and then every once in a while, I'm sure you get those patients that come in who have fractures or maybe they had to have surgery and they're trying to help that healing process after surgery. What do you usually recommend for those guys?
You know, that's a good question because actually just a short while ago, a good friend of mine fractured his ankle pretty bad and ended up having to have a couple of plates and a bunch of screws put in, okay? And so one of the things that we did as soon as we knew that he had injured his ankle, we started him on some supplements, one being Calcifood. Calcifood is raw amino acids. It comes from raw veal bone. And the reason why Standard Process uses veal is because older cows can build up a lot of fluorine in their bones. So we don't want that. We don't want that toxic bone. So that's why they use the veal bones. And it's raw. It's never been cooked, not steamed, nothing, because we want all those amino acids intact. Not only the amino acids, but there's also an enzyme called phosphatase that is in growing bone. And this phosphatase helps us assimilate phosphorus, calcium, iron, and a B vitamin, and inositol, and maybe other things too. So I gave him some Calcifood to get started on, and I dosed him pretty high. You know, Calcifood can come in a wafer, so I gave him, you know, like 9 a day, three times a day, because we want to stimulate that healing process. The other thing we did for him is we recommended some Ostrophin PMG. So this is the protomorphogen for bone, and it works very nicely with the Calcifood. Yes, there's some Ostrophin in the Calcifood, but just not enough. So we wanted to give a little extra of that Ostrophin bone protomorphogen to help with the long-term healing as well. So that's a couple of things for bones that you really want to take a look at. Now, this Calcifood will also help, and also the Bios will also help with the ligaments and tendons. So in the case of his broken ankle, he also injured ligaments and tendons. Well, those products are going to help those tissues heal as well. Now, sometimes you run into the patient who you get them long after the fracture, but they tell you, you know, they tell me it's healed, but it still gives me pain, it still gives me problems. That's when you look at the kidneys, because the kidneys in Chinese medicine have a relationship to bone. And I have seen a lot of these chronic bone type issues resolve by giving Renifood, okay? Renifood. From Standard Process, which is, you know, basically like a multivitamin for the kidneys, okay? So there is that, and I think that's kind of covered. What do you think?
Well, I remember a talk by Mark Anderson. He had talked a lot about the importance of vitamin C.
Absolutely.
And I know that you hit on that a lot with your patients. So can you kind of go over what you do as far as adding some additional vitamin C for collagen building?
Yeah, and so the good point, Tracy, and I'm glad you brought that up, because the vitamin C, the Cataplex C, the whole food vitamin C complex is going to have what's called the P factor, all right, or they used to call it vitamin P. And the vitamin P helps your body produce collagen. Well, if I'm not producing good, healthy collagen, which is how I assemble these amino acids to make collagen, then I'm not going to heal the bone efficiently, because that collagen matrix is vitally important for the minerals to adhere against to really give us some strong functional bone. So Cataplex C, Cyruta Plus, all vitally important to be that intracellular cement to help hold that bone and that tissue together. Not just the bone, but also the soft tissue as well, like I was talking about with my buddy's fractured ankle.
Awesome. Thank you so much,